アメリカテキサス大学 M.D. アンダーソンがんセンターは全米で最も優れたがん専門医療施設の一つとして世界から高い評価を受けています。そこでは分子標的治療など最良のがん治療の提供と最先端の研究、がんにおける標準療法の確立に力を注いでいます。 M.D. アンダーソンの根幹を支えているのは全米一を誇るチーム医療体制です。世界で最も有能とされるがん専門の医師、看護師、薬剤師など全ての医療スタッフが一丸となって取り組むチーム医療は患者さんのベネフィットを最大限に追求した画期的なシステムとして注目を集めています。
The benefit of multidisciplinary care to the patient is that the decision-making for treatment is not made by an individual practitioner with a specific expertise, but rather by a team deciding on what the best overall management will be for that individual patient.
It allows the patient to access the best information, the best knowledge from a wide range of people. And M.D.Anderson and oncologists in general deal with a lot of patients with rare tumors. And so having a large group of doctors who can share their experience when there's very little published literature or research protocols to help guide an individual clinician, that is very useful.
The difference between nursing now and multidisciplinary teams now and what it was like in the past, I think, is that physicians have empowered nurses. Physicians have been willing to listen to other disciplines and allow them to expand and grow.
If the patient identifies the nurse as really the primary person that they can go to for complaints or problems, that the nurses are on top of that in terms of helping the patients either get through whatever symptoms or problems they may be having, or to know when it's appropriate to let the physician know that a patient.
So what I see has been the opportunity to grow the nursing practice so that we can assist physicians in patient care. We can take on some of the other responsibilities so that the physicians can be more attuned and more available for more critical patient issues that may arise. So nursing practice has expanded over the years, and I only see that growth continuing.
Sometimes the best teams may have all individual really great players that don't play well together, and then those teams don't win. So I think it's important to get a team of people that are willing to work together towards a common goal.
As a clinical pharmacy specialist, that I'm very proactive in what I do. So always coming up with suggestions, ideas, thoughts, looking at the patient and the whole picture, looking at medications, different ways we can give medications to help improve things. So always being proactive and have great communication with the team that you're working in.
When we look back on our history here in the U.S., I think it's important to realize that the role that we have now didn't happen overnight. It's taken many, many years, a couple decades, for us to get to the point that we're at right now. And it's been through pioneering efforts from individuals as well as organizations to help us get here. And it's one step at a time and one person at a time are really what make the difference.
I would expect them to utilize their expertise in their fields to advise me on ways that they can assist in the care of my patient. For example, if my patient has severe bone pain from a metastatic lesion from their breast cancer, the radiation oncologist will tell me whether they feel that their therapeutic modality would be helpful in improving the patient's pain.
The physician is ultimately what we consider the quarterback of the team. They make the treatment plan and the treatment decisions regarding what the ultimate treatment plan is for the patient.
A multidisciplinary team allows us to bring a variety of expertises which are not available in the context of any one provider to the cancer setting.